Hello there, and welcome to Q&A number 4. Firstly, I want to say sorry for the delay on this. I know I'm a day late. Yesterday, February 7th, was my birthday. So I was trying to do it last night, and one of the things us CRPS folks have in common is we're not the best at, setting boundaries or caring for ourselves sometimes. Sometimes we will put the needs of others before ourselves, and that can cause a lot of undue stress for us. So I really wanted to get it out to you yesterday, but it being my birthday, I will not lie, I prioritized going in and enjoying some dinner with family. So thank you so much again for your patience, and I'm really excited to get into this one because the last one, I thought we had a lot of questions then. We have even more this time. So I'm super excited to share that with you. Whether you're watching this on YouTube or from within my 8-week self-guided course that just came out on February 1st, I'm excited to share it with you. For those of you that don't know about my 8-week self-guided course for CRPS, I have created a program that is completely self-guided. You can take at any time, and you'll be able to go through 8 different modules that could take you anywhere from 8 weeks to 32 weeks. And those modules contain all of my knowledge from the past decade of not only dealing with CRPS, but treating it every day at some of the top hospitals in the country. So if you're interested in that course, and while I've been talking, you've been seeing some images or video from that course, you can go to my website, thewindowpane.com, and click on the button that leads you to the courses, and you'll be able to go ahead and enroll there. You can enroll at any time. You can go through it at your own pace. Every single week, you will have a lecture module. You will also have a video of one of my pain coaching clients that I'm working with, so you can see them absorb the information from the lecture. And then additionally, you will have recommended readings. I think throughout the course, I end up recommending something like 12 or 15 books. So all the knowledge from all my years right in one place for you for a very, what I think is a low price. When I was going through CRPS, I didn't have any money. And so when I saw all these treatments that other people were offering, these different clinics or getaways or retreats, they're 12,000, 20,000, $100,000 out of pocket. And I was like, I never would have been able to afford something like that. So I wanted to bring you something that you could check out if you felt like it, and use. And so there's a bunch of different payment options, a bunch of different things for you. So hopefully it's attainable for you. And if not, keep absorbing the free information. If you're not on my email list, go to my website, thewindowpane.com, and join that. Every week I'm sending out free information, notifications of these videos, etc. So thank you to everyone who's been supporting these Q&As. Thank you to everyone who is in the course already. And also thank you to everyone who has just been in the Facebook group sharing their wins and victories every week. I really love reading it. It's been fantastic. So if you're not in my Facebook group yet, that's just the window pane on Facebook. You can check that out. So I won't be able to do this in one take because my dinner is on its way right now. So eventually I'll be interrupted. So that'll end our one take streak. But let's go ahead and jump into the first question here. Okay. So one of the very first question is talking about, could you do a video on different exercises that you do with your clients to help with range of motion in the hands and feet? Yeah, that is a video planned in the pipeline. That's already something that's within my 8-week course, but I will have a video coming out talking about that, and in even not only range of motion, but strengthening exercises, desensitization exercises, all kinds of stuff. So yes, Jess, that'll be coming 100%. All right, let's see. We've got Sandy. I've always been a fight or flight breather as long as I can remember. I know when I concentrate on breathing from my stomach, it does lessen my pain. I've tried so many techniques. I guess I'm wondering if some others go through this with CRPS. I always struggle with it. Will it one day come naturally? Practice is what changes it. If you've always been a certain way, just like if you've always, like me, I always want to snack on trail mix. It's very hard for me to stop snacking in that way. And so breathing, if you've been breathing like that your whole life, that's a very hard thing to change. But practice will change it as time goes on. If you also want to get out of fight or flight and calm the breathing, there are some apps that I recommend. The app that I would recommend is Insight Timer. There's a little icon of it right there. And there are three artists on the app that I would recommend, particularly Kate James, Vina Uragal, and Vidyamala Birch. They have body scan meditations that help you scan your whole body and relax and breathe naturally and slowly. And that takes us out of fight or flight and puts us into rest and digest, that relaxation mode. Remember, CRPS is a hyperactive nervous system, meaning our nervous system alarm, which I've talked about before, is overreacting. It's going off constantly. The way we reprogram that alarm is we start practicing the opposite of what's happening, that fight or flight, and we start practicing the rest and digest, the parasympathetic. So moving from, as I've mentioned previously, the sympathetic overloaded nervous system to the parasympathetic nervous system through some techniques that you'll see in this image here. Okay. But yes, absolutely. That is something you can change. You can always learn new things for your body. We are learning constantly throughout our life, whether it's a language or how to play piano or how to breathe differently. It just takes time. And I would also consider, what else in your life is leading to that fight or flight situation? Are there life stressors? Is there family turmoil, work turmoil? Is there what other things can you change besides practicing breathing to bring you out of fight or flight? I'll put up a diagram right here. That is a picture of what contributes to getting our alarm hyperactive. And I've gone over this in another video. But see those six categories there. Which of those six categories, from movement and posture to, our relationship with structures to the medication we're taking or our lifestyle or our personal factors, which of those can you address and change to start to bring you out of fight or flight? That's a good question to ask yourself, and maybe that'll find you a starting point. Okay, Kimberly, I have twitching, spasms, terrible leg muscle cramps at night, sometimes waking up from a dead sleep, only walking around, and pain meds seems to help. I've tried switching different sleeping positions. I take magnesium supplements and prescription muscle relaxer before bed. I do several PT leg exercises 3 to 4 times a week. I walk 6 to 7 days a week outside at least a mile, even though it's painful because I know the move it or lose it thought process. I've gotten it's I've gotten tolerable using desensitization techniques, so I'm able to wear shoes and socks. Still uncomfortable, but I can occupy my mind to not focus on the pain, and that helps some. But the cramps and spasms and twitching, I'm at a loss on this because I'm usually asleep when it happens. Any other ideas? Sure. Before sleep, just like I mentioned before, what is your process? Are you doing maybe a meditation like I just previously mentioned in Sandy's question? Or do you have a sleep routine? Do you have a process to calm down before sleep? Sometimes this twitching and this cramping can be a factor of our nervous system being overloaded. It can actually even be, like restless leg syndrome. That can sometimes be an anxiety-induced response. So what are we doing to prepare for sleep? Some of the things that I recommend for my clients is have a sleep routine, have a certain set of clothes that you wear to prep your mind for bed. Have a sleep time tea, like a chamomile tea and honey that you drink every night to prepare your mind for bed. Have a hygiene routine before you get into bed. And then other things like controlling the temperature of your house or your room better. If you can fall asleep more effectively, then you can stay asleep more effectively. And you might find that over time, not right away, of course, that cramps and the spasming and the twitching starts to come down. If you're not on my email list yet, Kimberly, I would join that. I send out my sleep toolkit every now and then to new subscribers, and that has 10 items to help with sleep. So that's a free toolkit I send out. So you can find that there. Donna, any recommendations on how to reduce CRPS flare-ups during cold days and nights, and how to handle, and then same thing with Gina, how to handle or reduce symptoms during the cold weather? Okay, so with our nervous system hyperactive, any change we're going to sense it. Okay. Again, consider it like a house alarm that's malfunctioning. So it's malfunctioning so much that when you step out of bed or like knock something over in the kitchen, the whole house alarm goes off. So when we're having cold weather or we're having pressure changes or we're having our menstrual cycle for the women here, um, you will have the alarm going off. And so the same strategy applies with calming the alarm. Think of those six factors I mentioned in Sandy's question. What of those things can you change to start to calm the alarm down? Okay. Then the symptoms of those other alarm malfunctions, like the feeling in the cold and the feeling, some people get feelings when it's hot, those will start to come down as the alarm calms down. It won't be overreacting so much. The way I kind of phrase it is like the house alarm's going off and the sink is turning on and the lights are flashing. No house alarm does that. That's working properly, right? That could be some wiring issues. And so the way we reprogram that is by starting to calm the alarm as much as possible. And then you'll notice those symptoms from cold weather or pressure changes or even our menstrual cycle will start to reduce. Okay. Otherwise, what I would do is when you start to feel symptoms during the cold, you use heat or something on your limbs as tolerable to kind of mitigate that change in temperature. If we need to turn the house up a little bit without everyone melting or something like that, then that's what I would recommend for now until the alarm starts to come down again. Okay. Okay. Brid. Hi, Chase. I'm wondering if you could discuss a bit about CRPS after a partial wrist fusion. Had a four-corner fusion of the right wrist due to Prizer's disease. I had a failed fusion due to non-union, and then 6 months later, a more successful surgery. And then a year from this, hardware removed. I am 3 months post hardware removal. The wrist essentially feels like it's turned to stone. The small mismovement that I could achieve through physio is not being achieved due to unbearable pain. CRPS pain and then pain from how stiff the wrist and surrounding muscles are. I do some desensitization and movement exercises. I take medications, but I'm getting nowhere. I don't have much interventions. Doctors seem to pass me along to another. If I use the hand wrist much, I'm in pain and find it makes my life harder with three young kids. So I am avoiding to a certain extent. I'm a mental health nurse and off work 2 years. I'm being told with the fusions I may never work again in many areas due to my limitations. Have you experienced or insights in this kind of situation? Thank you. Yeah, Brid, you're not alone in your experience of multiple surgeries and then having CRPS afterwards. There have been a ton of break-ins to your house. A surgery, the body counts that as a break-in, just like the body counts the stress, of being a mom to three young kids. Okay, and then the stress of the pressures of trying to return to work. So that's a lot of different stress avenues that are contributing to the alarm that you're having here. Um, what I would ask you if I was working on you one-on-one is I would say, what is considered too much? How much movement is too much? For me, too much movement in the beginning was wiggling my toes more than 5 times. So I would wiggle my toes, four or only 5 times. And so that's what I would say. I would say find your limit and go underneath that limit just a little bit, moving slowly up and up and up as things get more tolerable. So avoiding it, for sure is not going to change anything. Because if you avoid it, then your nervous system and your body and your brain never learn how to handle the movement, and you need the movement for work and for life. So what I would do is I would not avoid this. And I would find the smallest amount of movement that is tolerable and start there and go very slow. That's the problem with a lot of physical therapy. The providers are under pressure from insurance companies or what have you, and they need to get some certain level of metrics of improvement. Otherwise, they will drop you. The insurance company is not the PT, right? So they're under pressure. So what I would say is start as small as you possibly need to and improve over time. For me, to give you an idea, it was 5 toe wiggles a week, and then it was 10 toe wiggles a week as tolerable. Okay, so it starts small, but then eventually you're getting to moving the hand, moving the wrist, etc. So as small as you need to start, and then move up from there. I know that's, not the funnest answer, but that is the strategy I would apply if working with you. Additionally, I would explore the stressors in your life. I know as a mental health nurse, you know how mental health can take a toll on things. I can imagine that there's a lot of things that might be very difficult right now, and I would figure out an avenue to start to reduce that stress in small amounts as best as you can. We can't change everything right away, but there's always something we can do to make our day 1% better. And remember, the power of 1%, 1% better a day, is 37 times better at the end of the year. So I hope that's helpful. If you want to reach out to me, yeah, in a consult or something, I'd love that. But anyways, that's my advice for now. Okay, Trisha, any additional tips for managing pain while on my feet all day? I sit when possible, wear comfortable shoes, switch to supportive sliders, massage stretch as often as possible, but the pain still worsens as the day goes on. What else could help? So sometimes as we're on the road to reducing pain, and there's unavoidable situations. And for you, I know you're a teacher. There are some unavoidable situations when it comes to going through our day as a teacher. So I think you're doing everything right now. You're resting when possible. You're massaging, you're stretching as much as you need to. I think that you're doing everything right, and I would stay the course. You've been steadily improving since I've watched you from the beginning, Trisha. And so, don't look into it too much. I know that easier said than done, but my recommendation would be continue forward. Rest more if you need to, or rest more on the weekends if you need to when you're not at work. And that I think would be the best course of action for you. If you need to use something, like a pedicure foot spa or something to like relax afterwards, in addition to the massage, then go for it. But yeah, allow yourself rest and continue forward. Your body's getting used to walking and moving again, because remember, you weren't for a while. So it's going to take some time. Jess. I have another question. How do you push through the pain? I have guarded my hand and no longer have the fear to try and use it, but when I do, I have to stop when it hurts at a certain point and tell myself that this is okay and this certain movement shouldn't hurt. Yeah, so that's good. That mental refresher that like, okay, this movement is normal. It shouldn't be hurting at this point, like reassuring yourself. But also at the same time, listen to your body. When we say push through the pain, I don't mean push to um such an extent that you're crying or you're reeling or anything like that. We want to poke the bear of pain, but we don't want to wake it up. Does that make sense? We go slowly forward. And if we end up having a flare in relation to our pain or anything like that, then we take a step back and we reevaluate and we say, okay, this was too much for me, so I'm going to do a little bit less. And again, over time, it gets easier and easier and easier. Okay, the brain is learning what is safe again. For whatever reason, our nervous system, whether it was due to a surgery or life events, etc., is hyperactive. The only way to calm it down is to give it the information of this movement and this activity. So great question. Amy, does RLS and CRPS like to hang out together? I've had RLS randomly for many years, way before being diagnosed with CRPS. Inquiring minds would like to know. I like that, Amy. Very, very cool. Um, Restless leg syndrome. Yeah. Yeah, they do correlate. As you know from working with me, CRPS is a very much mediated by stress and emotion, and so is restless leg syndrome. That anxiety and feeling that we get at night when we're going to bed, and all of our thoughts are ruminating, and we're thinking in spirals and feeling depressed or down because it's dark and we're alone. That could lead to us having some restless leg syndrome, some anxious symptoms. With restless leg syndrome, you know, you're so anxious that your body is almost like trying to make you run. That's the way I visualize it. The few panic attacks I've had in my life, every single time was in bed at night, and it felt like I was trying to run away. I was moving my legs so much. And so, yeah, in that regard, restless leg syndrome and CRPS, have a correlation with each other. But again, correlation is not causation. It's just something that's related. Other conditions that seem to be, hooked onto CRPS, other alphabet type conditions, as I like to call them, you'll see often POTS or AMPS or FND, um, or fibromyalgia or thoracic outlet syndrome. New ones that I've been seeing popping around are chronic Lyme, chronic fatigue, mast cell activation syndrome. All of these things, in my opinion, are a consequence of an overactive nervous system, an overactive alarm system. And so the body begins behaving in strange ways because of that overactiveness. And so again, as we start to desensitize, bring down and calm the alarm, we'll see these symptoms also start to come down, because the alarm doesn't need to sound off as much anymore. If we can get into a position where we're stuck in fight or flight because of neuroplasticity and the things in our lives and the surgeries, et cetera, then by virtue of the fact that we could get there, in my belief, we can get out of it or at least reduce it. Okay, so we'll work on that, and you've seen some examples already on the process there. Okay. Have you dealt with anyone who had nerve damage after a DRG trial, specifically where it was located after leads were removed? Yeah, so I've had plenty of patients and clients who have nerve damage. I myself, as someone who is dealing with type 2 CRPS due to potentially nerve damage, um, am fully better. Okay. Nerve damage isn't necessarily a reason for pain. And how do I know this? Have you ever seen an amputee? Amputees literally have their legs cut off or their arms cut off, gone. Nerves are super damaged because they're by virtue of the fact they're cut in half. And not only nerves, but bones, blood vessel, muscle tissue, etc. And only a certain percentage of amputees have phantom limb pain. Okay, so nerve damage is really neither here nor there. The process is still the same. We need to calm the nervous system. We need to re-educate the nerves. And that's why amputees, even amputees, will do desensitization to re-educate the nerves of the amputated limb. Okay, and the surrounding areas there. So yeah, I have dealt with people in that situation, but that doesn't change the process by which we address the pain. Melissa, what do you do when you have multiple other diseases, conditions, and all you hear from your doctors, you may have CRPS, but because of this condition or that disease, you're unable to be treated for it? Um, so Melissa, actually, everything that I advocate for isn't is are things that you could do from your own home. There's not necessarily medications that I'm pushing or procedures that I'm pushing or anything like that. I definitely feel for you that it's a hard situation, but there are 100% things that you can do, whether it's on your own or working with a physical therapist or a pain specialist to address this pain. And I need to know you more one-on-one to understand what that might look like for you. But go through my other videos and I'm sure you can find things that you could at least start with. Angela, my daughter has been told keyhole surgery is now the answer, so on emergency list for this. Will this make the pain worse? And if they can't find anything on MRI, X-ray, is this the correct procedure to upset nerves even more? In my opinion, it's another break-in procedure. Now, as a disclaimer, I don't know your daughter's medical history entirely, so I can't really like speak too much on this, but in a vague sense, in an objective sense, or when I'm looking at someone who has CRPS, I don't know that more exploration or more surgical intervention is the best idea because again, we have a hyperactive alarm system, and if we have another surgery, that's another quote unquote break-in. And so for me, I would say that I wouldn't be in favor of something like that. Um, but I'd have to know her medical history more, and I'd have to understand, those sides of things before I could make like a judgment on whether this is good or not. But if you can't find anything on MRI, and this surgery is just to like search for something, and she's already been diagnosed with CRPS, I'm not sure what the benefit would be. That's my opinion there. And give me 1 second. This is where you'll see a cut because I believe my food just got here, so I'll be right back. All right, I'm back and I've adjusted the lighting so I don't look so blue and purple all the time. Okay. Kelly, this question refers to my FBSS, failed back surgery syndrome, rather than my CRPS. Lower back pain has really ramped up since I've been going to the gym, trying to get stronger and desensitize the CRPS. I've been on Oxycontin since the back surgery in 2019. I take it 4 times a day, every 6 hours. To say it doesn't last 6 hours anymore is an understatement, and my goal is to wean down my dose. But oh my God, the pain I feel after the gym for the next 2 days is awful. It seems like the Oxy is only giving me about 1.5 hours of relief. Do you have suggestions for what I can do when the worsening back pain and when the meds aren't hitting it? I stretch, hot water bottle, and lately even a short walk is hurting me more. Yeah, Kelly. So, when you are doing anything new, which going to the gym and trying to get stronger is something new, you're going to get soreness. Soreness from using those muscles, especially when you have a nervous system that is hypersensitive to new stimulus. So you're not only having the soreness, but you're having soreness that is amplified. But the fact that you said this soreness lasts about 2 days tells me that's purely related to using those muscles. So even though it's frustrating, this is kind of part of the process. Actually, soreness lasting about 48 hours is kind of the goal for someone who is trying to get stronger. If I go to the gym and I don't feel sore, in some sense, then I'm a little bit disappointed because that soreness shows me that I did enough to start to get stronger. For you, what I would suggest is maybe ease back on some of the activities at the gym just a little bit when you're feeling this soreness. Give yourself some time to recover a little bit more, and then go back into it. Okay, so that's what I would suggest when it comes to mitigating that soreness. But the soreness, in certain ways, is a good thing too. So it's about finding a balance there. And we can talk about that. You work with me privately, so we'll talk about that some more. But great question. Okay, another Kelly. When did you get your movement back in your toes? Some days I have some movement. Other days they are stiff as a board. Been doing physical weekly for almost 2 years. Is it more of a physio aspect or getting your nervous system back in order that helps with that? I would say it's both. Our nervous system is all over our body. It's mitigated by both physical stimulus and emotional and mental stimulus. So I would say it's both. What I would suggest for you to do is on the days when you don't have movement, when the days that it's stiff as a board, I would ask you to inquire about what's going on those days. Are those days that life is more stressful? Is it a Monday, versus a Friday? What's the pattern? And then look and see, what contributing factors are part of that pattern. Is it life stuff or is it physical stuff that you're doing? Um, I didn't like get my movement in my toes back in like a way that all of a sudden I just had it. It was a gradual process, slowly but surely. And then even on those stiff days, if you can tolerate it, I would try to move them, press your fingers against them gently or a pillow against them. Even on the stiff days, I would continue to try to move them to give them that feedback. So yeah, to answer your question, it's a combination of both physio and calming the nervous system as much as possible. Okay, so I had two questions here that I'm reminding myself about. So Teresa said, what are the best apps for rewiring the brain? So you can use any type of meditation app. The app that I like is Insight Timer, which I've mentioned earlier. But other apps are Calm. The YouTube app to look up non-sleep deep rest (NSDR) recordings or yoga nidra recordings to calm the nervous system. There's a plethora of things that you can do for calming apps. Meditation is the first place I go, but even apps that have like relaxing brain games or relaxing images for you to look at would be really helpful too. And then Christy said, mast cell syndrome. What type of doctor do you see? Why are CRPS and mast cell syndrome seem to go together? Again, uh, as time goes on, I see more and more pointing to all of these different conditions seeming to be associated with CRPS. In my view, it's all a consequence of a hyperactive and overreactive nervous system. Okay. That could be the nervous system could be activating certain cells. It could be causing us to be dizzy, short of breath, extra fatigued because of that overload that we're in. All kinds of those things. So that's why they seem to go together, is because they're kind of, in certain ways, the same type of problem, an overactive sympathetic nervous system. Leah, I read somewhere that CRPS can act as an opiate receptor blocker. Is this true? I had a doctor taper me off opiates, oxycodone and fentanyl, in 2019 because they just didn't seem to be working anymore. CRPS started 18 years ago. Okay, so CRPS is a nervous system condition. Opiates seem to work more on pain that is originating from like muscles or bones. In the nervous system, it's kind of hard to get benefit from opiates. I know that a lot of you are hearing this and saying, "Well, I feel benefit from it." I don't doubt that. I don't doubt that you feel some benefit or feel relaxed or more uh, calm or out of it sometimes. That's how I felt when you're on opioids. Okay, I understand that. But the medications that actually target the nervous system are things like gabapentin and pregabalin or Lyrica. And that is desensitizing our nervous system specifically to calm things down. So opioids aren't necessarily an opiate receptor blocker. CRPS isn't necessarily blocking the opiate receptors. It's just that the opioids aren't necessarily fully effective on CRPS. And then additionally, with long-term opioid use, you can get something called opioid-induced hyperalgesia or allodynia. And as you know, allodynia and hyperalgesia are part of CRPS, that sensitivity to touch and things that shouldn't be sensitive. So that is why we look at trying to wean off these medications, because sometimes it can end up that the medications are causing some of those symptoms. That's why in the CRPS groups, you see people saying, is anyone else having skin rash, or is anyone else having gastroparesis? Is anyone else having this or this or that? A lot of times, the reason those conditions are developing alongside CRPS isn't because of CRPS causing it. It's because of the medications and the lifestyle we're leading while dealing with the pain of CRPS. Okay. Hopefully that is both eye-opening and relieving to know that CRPS isn't necessarily the direct cause of these things, but a consequence of the things we're doing to manage the pain. Okay. So weaning off opioids is the correct move eventually as the pain starts to come down and we start to move towards life again. Okay, so I think the doctor had the right idea with doing that, and hopefully that was helpful for you. Or maybe you noticed, I know some people, when they start to wean off opioids, they notice their pain coming down because that opioid-induced hyperalgesia or allodynia starts to reduce as well. Karen, why do I have symptoms while I'm awake, but when I sleep, I don't have any and my foot gets warm? Almost as my body resets while I'm asleep. Yeah, Karen, I mean, you're spot on. When you're asleep, your body is no longer in fight or flight, it is in rest or digest. So the sympathetic nervous system is named fight or flight or freeze, and the parasympathetic nervous system is rest and digest. So when you go to sleep, if you're getting a restful sleep, you're going to have a calmed nervous system. And then, of course, those symptoms are going to calm down. Of course, your body is quote unquote resetting, as you say, while you're sleeping. That makes perfect sense, especially with the way I present CRPS as the condition is. Okay. An overactive nervous system, when we calm it, of course, the symptoms go away. Now, let's just see if we can calm it during the day when we're awake. That's the next step. Okay. Next question. I get really irritating, restless itch from time to time, and nothing helps when it happens. Any ideas on what to do? So from an itch standpoint, the only thing that comes to mind for me is like a bag of cold peas. That seems to be the remedy for me when I have an itch. I would be looking into what kind of soaps you're using. Remember, if the nervous system is hyperactive, sometimes things that aren't necessarily irritating can be irritating. Sometimes we'll get worse reaction to pollen and have worse allergies. Sometimes with that worse allergies, we'll have more of a reaction to our laundry detergent or our soaps in the shower. So I would experiment with that and see if that makes any difference. Switch out some of your soaps, one soap at a time, so that we're not throwing too many variables. But that would be my idea. And again, as we calm the nervous system, in theory, the itching would start to calm as well. Jen, I continually swell up in my right hand. I continually wiggle my fingers and change my position, but it creeps back. I have used a compression sleeve and it reduces swelling, but where the sleeve ends, my arm swells. If the cuff of my shirt sleeve sits on my hand, I can see swelling where it touches my hand. Any suggestion to control this swelling or edema? I have used ice and heat. Okay, so the first thing that comes to mind is hydration. You're already moving your hand. You're already using some compression things. So the next thing I would consider is hydration. How hydrated are you? If you need to, you can pick up an electrolyte drink of some sort. I'll put a brand that I like there. It just has cool flavors. You can pick any brand. But I would consider that. See how that helps with the swelling. I would continue to actually expose your hand to touch where your sleeve shirt touches your hand. I would actually experiment with touching your hand more as tolerable to try and calm down the hand alarm that seems to be going off. Giving the hand more information is going to be key. You can also use something like kinesio tape, which I'm going to put here, and you can tape it in a gentle position to kind of like pull the skin up. And that pulling the skin up will actually allow for some of that edema or some of that fluid to dissipate a little bit. Okay, so if you can tolerate tape, kinesio tape, which is a little bit less irritating than something like duct tape, right? If you can tolerate kinesio tape on the hand, try that. And I'll put an image here of a hand that's kinesio taped. Maybe if I can find one for like fluid drainage potentially. Okay. The great thing about kinesio tape is whether it's helping the drainage or not, it's giving your hand sensory feedback by virtue of the fact that it's pulling on the skin and giving the brain feedback that the hand is okay, the hand is safe. And also, if you're using kinesio tape to give your hand sensory feedback, I would tape both hands, even if the other hand isn't swelling, because the brain likes to understand what's happening on each side of it. Okay, so the brain's uh, image of our body parts is mirrored from side to side. So I'll show the homunculus here, the motor sensory cortex. You can see that it's mirrored from side to side, hand lining up with hand. And so that's a reason why, as the nervous system becomes more hyperactive, we see things happen like spreading to another hand. It's not because CRPS is like a venom that's like moved over to our other hand. It's because the brain's map of the hand has become smudged, and in order to unsmudge it and unlock the map, we need to give the brain more information. So taping on both sides, or when you do an exercise with your hand, do it with both hands at the same time. That's going to help update the brain's map in both areas. And I think that'll be really helpful also. So yeah, if another thing that would be really good for potentially the swelling of the hand is squeezing a ball with the hand if you can tolerate it. So I would let me grab the ball. I have some right here. I also have kinesio tape. So this is the kinesio tape. Okay. And you can see that the tape is on the athlete there. And then here are some, they're just grip trainer balls. You can look up on YouTube, strength training grip ball or strength training stress ball. What I would do is on the affected hand, I would use the soft ball and squeeze that as hard or as gently as you can. And then on the unaffected hand, I would use a harder ball and squeeze it at the same time. Because remember, we're updating both parts of the brain while doing that. That's why we do things like mirror therapy to update the brain's map. Okay. Especially in mirror therapy and amputees, we're updating the map. And that's why mirror therapy works for CRPS as well for some people. Jen, my physical therapist doesn't know what to do for CRPS specifically. He has had me building up my strength through exercise and strengthening. He has worked on muscles that are trying to contract in my thigh and hip, but he just says, I'm sorry about your foot. What or where can I direct him so he can learn how to help me? Jen, I have done this with a ton of my clients and people who aren't working with me directly, who are just absorbing my free information. You are more than welcome to reach out to me in messages and get my contact info, and I'd be happy to talk with him. Otherwise, could direct him to my YouTube, have him watch some videos that I've put up, specifically the one about desensitization on YouTube. And I'll put that here, the thumbnail, so you can see which one I'm talking about. Have him watch that and maybe give him some ideas in that sense. I've had multiple physical therapists calling me and picking my brain, so I do not mind to do that. So feel free to reach out in messages on Facebook, and I'd be happy to connect with them. Karen, hi Chase. Thanks for your videos. They are so great. Well, thank you, Karen. You summarized so eloquently what I've learned the hard way since my injuries 25 years ago. I wish I knew this sooner. Me too. Me too. I wish 10 years ago I existed from the future. I don't know. But yes, I do wish that I had some of this earlier. Um, my current question is re-injury. I had a significant skiing accident and re-injured my quote unquote CRPS leg 3 weeks ago. So hard for me to know what is normal tissue pain and what is CRPS pain. I refuse the immobilization boot and I'm trying range of motion as much as possible, taking vitamin C. Otherwise, any ideas? So firstly, it's only been 3 weeks, 4 weeks now since this question. No matter what it is, whether it's normal tissue pain or CRPS pain, the plan is still the same. The plan is still the same. Yep, just like you said, we keep moving. We introduce weight bearing as tolerated, and we slowly, with graded exposure, return to walking or moving. So no matter what the pain is from, no matter what it's due to, the plan is still the same. With CRPS, I really believe the antidote is keep it as simple as possible, be as calm as possible, and move forward. And I would also encourage you to just call it your right or left leg instead of your quote unquote CRPS leg. I know that you did that for the purpose of this question, but I joke a lot with my clients that you should be careful what you say because it can hear you. Okay, so if we call something our bad leg or our bad back or our bad shoulder, we're going to treat it that way subconsciously. When we have a bad shoulder, when we go to reach for something with that arm, we're going to be more protective of that shoulder. So I would encourage you to call it right or left. You probably do that already, given that you were skiing, but you're going to get back to skiing. Okay, it's going to be fine. Continue to move around, continue to try to put weight down on the foot as much as you can. And over time, it'll get better. All injuries, all tissue injuries heal typically within 4 to 16 weeks. Okay, so you're getting close to that 4 week mark. It's going to get better. Promise. Promise, promise. Okay. Kelly, dealing with the long sighs and those looks you get from those who don't understand. In my case, it's often my adult kiddos. I get it. I used to kind of roll my eyes at those who always claim to be in pain. I thought it was laziness or all in their head. It's hurtful. Even when you have experienced CRPS, no one gets it. How did you deal with that? Friends ask you out and you can't because of pain. Well, for me, it came to a point where I realized, I don't need to explain it to anyone. Um, it's my pain, it's my experience, and it's my responsibility. And so, yes, it is frustrating. Yes, it does hurt, but I can't control someone else's response. I just can't. That's just reality. That's just life. So if someone else is going to respond that way, it's out of my hands. All I can do is be honest with myself, honest with them, and say, I'm hurting and I'm really sorry, but I can't go out this time, but I want to in the future. That's how I dealt with it. At first, I would get really angry. At first, I would, seethe within myself that no one understands and no one cares, etc. But people are complex inside and out. They have their own lives that they're living. They have their own things going on, and I can't attribute malice to them if it's really just misunderstanding. It's not their job to understand what's going on with me. It's my job to just explain, and then if they get it or don't get it, that's out of my hands. So I know, maybe that's not the best way to answer but really I don't. I realized I didn't owe anybody any explanation. This is what I was dealing with. This is my life, and I move forward from there. And so, yeah, that would be my advice. Accept as much as you can that this is what you're dealing with. This is a personal fight you have. Educate as much as you feel like you need to, and then move forward because that's really your only choice. You can't, like I said, you can't change what's going on. in their head. It's what's going on within you that you can control. Sarah, hi Chase. My CRPS in my right hand was triggered by a very small injury to my dominant hand and from restricting movement with buddy taping, bandage wrapping, and then eventually a wrist brace. Each stage led to more restricted areas. I have read that a compression sleeve could be helpful for pain, but could this cause further restriction to the movement that I have been working hard to accomplish? I want to move forward rather than back. Thank you in advance. So I'm of two minds on the compression sleeve. If you get a really, really light one, it might feel a little more supported and then you can still continue moving. If you get one that's like super firm or stiff or constricting, then that might lead to restriction of movement. But I wouldn't necessarily say that it's moving you backwards because the feeling of the sleeve on the wrist is giving feedback to the wrist and hand. Does that make sense? Like when you move, you're feeling that texture, much like the tape that I mentioned earlier. When you move, that tape is pulling the skin like this, and you're feeling that feedback, and the brain is getting all these messages teaching it. Okay. So, with a compression sleeve, I see pros and cons. Make sure it's loose fitting compression. Like I have some socks that are compression socks that aren't too tight. That might be the answer for you, is find a really loose fitting compression sleeve. But it's not forever. Okay. It is a temporary thing as we retrain our brain. Okay. So yeah, great question. That's my answer. Sarah, again, I have a second question. Is it possible for gabapentin to increase pain rather than making it better? Now that I'm only taking this medication, the pain is extreme in my upper arm due to a calcium deposit until it wears off the next day. The pain is extreme. If you're taking the medication and it's extreme, then I would consider weaning off the medication. Guys, if the medication isn't helpful, you don't have to take it. Okay. Speak with your provider about that and say, hey, this medication, I think it's like making my pain worse. And say, like, is there anything else that I could do, or can I wean down off of it? Is it okay to do that? If it's making your pain extreme, then I would consider reducing the amount in which you're taking. That would be my advice. And yes, for some people, gabapentin has the opposite effect. For me, both gabapentin and Lyrica seem to make my pain worse. I did not like them. And I did the same thing you're doing. I took them thinking that I was supposed to. And then I realized, they're not helping. So why am I doing this? And if I had expressed that to my doctor, they probably would have said the same thing. But yeah, that would be my advice. If it seems to not be helping, talk to your doctor about it and see if you can wean off or switch to something different as a bridge for now, not a road for life. Okay. Amy, good morning, Chase and fellow badasses. I'm currently traveling, so I haven't seen the latest video. If this has been touched on, please spin and point me where. Deep bone pain. Why am I feeling this incredibly painful, often sometimes paralyzing pain, and how do I get it to stop? Um, Amy, I'm gonna sound like a broken record a little bit here, but again, the alarm system does some weird stuff, and retraining the alarm is the answer. If you're having deep bone pain, I would suggest I know which Amy this is, I'm pretty sure. I would suggest you go and do some exercise, and the reason I say that is because Wolff's Law. Wolff's Law is the concept, which I've touched on before, that the more our bone is exposed to forces, the more that it remodels and gets stronger. So if you're putting weight on your body and you're doing exercises like leg presses or squats or sit to stands, etc., you're going to be building up your bone, which reverses that bone demineralization effect that we see from disuse while dealing with CRPS. And that deep bone pain you might find starts to decrease or go away. So that would be my answer. If we're gonna resolve the pain or resolve the weird alarm sensations, we need to calm the alarm and we need to strengthen the bones. Gidget, how can I deal with muscle spasm better on my own? My muscles tighten so much on my affected side that my hand and foot will go numb. I feel like they're being crushed. I've tried hot baths, heat pads, muscle creams with little relief. It feels like a nerve is pinched. Also, have you dealt with ketamine allergies and CRPS? I had a bad reaction in 2018. So firstly, the allergy portion, like I mentioned, when our nervous system is hyperactive, it might take not so kindly to different medications or different stimulus like pollen, etc. And we might have an allergy response of that nature. Give me a second. I'm getting more and more blue and purple. Okay, there we go. I opened the blinds. That's much better until the sun goes down. So yeah, it might happen sometimes. It sounds like you had a reaction in 2018. If you're still having ketamine, are you having it every time? If you are, how helpful is the ketamine? If you're not, then it must have just been the situation that your nervous system was ramped up to that level in 2018 for some reason. And my question would be, what happened in 2018? Was there something significant? That's something for you to explore. From a muscle spasm perspective, you are saying you've tried hot baths, heat pads, and muscle creams with little relief, and it feels like a nerve is pinched. Okay, so one thing I noticed when you say this is you say hot baths, heat bath, muscle creams. Those are all passive activities. They are not active activities. What I mean by that is you just kind of put it on. You're not actually doing something to move, right? So if it's in your hand and it feels like a nerve is pinched, I would suggest something called a nerve glide, okay? A median nerve glide, which is for the hand, is going to be like this. You're going to be holding a tray and you're going to go out to the side and you're going to dump the tray out, okay? Holding the tray, dump the tray. And you can add to that by moving the wrist. If this is too hard for you to glide the nerve, you can stay here and go like this. If that's too hard, you glide your nerve even by being down here and going like this. Okay. What that's doing is it's taking the nerve and it's flossing it through the canals that it runs through around the muscles and bones. And it's clearing out inflammation that's in there and giving the nerve information and might make it feel like it's less pinched or pinchy. Okay. That's a median nerve glide. Now I'm going to show you a sciatic nerve glide for the sciatic nerve, which we all know is a demon, as we've been told. So that's gonna be like this. And fair warning, I have shorts on, so I don't want to jump scare you. But you're gonna sit like this. To glide the sciatic nerve, you're gonna kick your leg forward and let your head come down. Okay. This should be like a little dance. If that is too much for you, bring your head back as you kick up. That'll change how it feels. Might be easier. And if that is too much for you, just kick up like this. And if sitting down to do it is too much for you, you're going to lay down flat on your back and you're going to do it like this. And here's a picture of that nerve glide there. Okay. So yeah, try some of those nerve glides, whether it's affecting your hand or your foot. The median and sciatic nerve glide are fantastic. And if you need more nerve glides, just, go to YouTube and type in nerve glide, and I'm sure you'll get a ton of videos there on how to do it. But I would take a more active approach rather than this passive approach with the heating pads, the creams, and the hot baths. Even those are great. I would want to move and take control of this better. Okay, Pamela. Chase, I listened to your video. Awesome information. I might have missed on how to settle down a flare if you're not on a lot of meds. I have full body and I'm very active, but when a flare happens, I'm flat on my back. I would like to know ways to manage them. I've been managing for 22 years, but they seem to be getting more extreme. I do receive ketamine. I went once a month 5 years ago. Okay. So, kind of the same thing I've mentioned a few times. We want to calm the nervous system down in any way we can. For me, some of the things that calm my nervous system is burning a vanilla candle because they relax me. They were nostalgic for me in relation to my mom. Eating my favorite snack, watching my favorite movie, laying down and doing one of the meditations I've mentioned on the Insight Timer app. Anything you can think of to calm things down is going to calm down the flare. I would also recommend you remind yourself that flares are called flares for a reason. They burn out, okay? It's not going to be forever. I know that's easier said than done when you're in one, but maybe write down some mantras for when you have a flare that can help you get in the mindset that this is going to pass soon. Okay. It's really easy when we start a flare to start to worry that is this our new normal? Is this going to go on forever, et cetera, et cetera. So I want to find ways to interrupt that feeling, interrupt that thought process. Okay. Flares are closely tied to anxiety attacks in the sense that they can induce anxiety or they can be something that is brought on by anxiety. So things that can calm the anxiety, calm the fear is going to be the answer to managing the flare. Okay. And that's why ketamine seems to be helpful, is because ketamine is a tranquilizer. It makes you tranquil, it makes you calm. And so that's why we find relief in that sense, because it's calming down our nervous system, as I've talked about. Okay, Rose, I was recently diagnosed with CRPS, most likely the result from a third level cervical fusion. I need another cervical and lumbar surgery. Great pain from this two condition plus CRPS. Okay, neurosurgeon emphasized how surgery would most likely make CRPS much worse. That is scary. This is now too much. Bedridden. Any advice? Which do I choose first? Well, I would encourage you, without knowing your medical history, just knowing generally the outcomes when it comes to fusions, I would encourage you to research a little bit about these surgeries, okay? A place to start, let me grab a book that I have over here on the bookshelf. Give me a second. A place to start is going to be this book, Surgery, the Ultimate Placebo, by Ian Harris. This is written by an orthopedic surgeon, so someone who's performing spinal fusion surgeries, right? Orthopedic surgeons and neurosurgeons kind of tag team on these kinds of surgeries. Um, we do more surgeries in the history of the world on the back, and we have more back pain than we've ever had in the history of the world. So our back surgery is really the answer. That's something to ask yourself. I've had two back surgeries, and looking back with what I know now, I wonder if they were really necessary. So what I would say is consider that maybe surgery shouldn't be the only option. But again, I'm not entirely sure what your medical history is, so I'd actually have to talk with you a little more one-on-one to get a picture of that. But what I would say is, what are your other options besides surgery? Can you go after this conservatively? Can you do home health physical therapy? Can you start to move again slowly? That would be my question, and that would be the questions I would ask yourself. And I would also pick up and read this book. I think it's only in text version. I don't think there's an audio book, unfortunately, but it is quite eye-opening. Yeah, that's the best way to put it. So I would check out that book, A Surgery, The Ultimate Placebo by Ian Harris. Okay, Jose, I've heard a few CRPS doctors recommend digestive enzymes. What was your experience with diet during your fight with CRPS and your take on the importance of the gut microbiome on CRPS? Digestive enzymes could be helpful. My experience with diet on CRPS was I lost 60 pounds. I went from 210 to 150, and I'm 6'1". Okay, so I was a frail string bean walking around on my mom's walker by the time I started my road to get out of pain. My diet was not good. I couldn't eat. I ate maybe one protein bar and half a protein shake, and those protein bars were called Zone Perfect back then. I don't know if they exist, but I'll put a picture if they do. And I can't even look at them now because I ate so many. That was what I sustained myself off of, kind of. So, anyways, my gut was all kinds of messed up. But a big reason for that is because, remember, we're stuck in fight or flight, so we're not in rest and digest. Okay, so a way to help might be taking some digestive enzymes, sure, but also, relaxing as much as we can. And I'll show you a book that pertains to that. Let me grab it. It's on the shelf again. Actually, no, it's not. I just gave it to one of my patients at the hospital's mom to borrow. It's called Zebras Don't Get Ulcers by Robert Sapolsky. And he talks about how stress relates to our gut microbiome. So I would pick that up, Jose, or listen to it. And I believe you're in my 8-week self-guided program that I mentioned. So you're gonna run into that book eventually in one of the modules there. So look out for that. I think that one would be good for you to read. Julie, um, Julie has a long history here, and I'm gonna. Okay. Let me read this. If you want more info, please message me. I might do that, Julie. Everything started for me in 2013 after a really bad football accident. I tore all the ligaments, muscles, and tendons from the top of my left pelvis to the bottom of my left knee. Wow. I also fractured my left femur, ruptured my bursa sac, and broke the ball of my hip. and fractured the socket of my left hip. I had several reconstructive surgeries, then developed CRPS in my left hip, thigh, and pelvis. It ended up spreading to the whole leg and foot. It went 3 years undiagnosed, then another year between me before we started treatment. The first few treatments made it way worse. This is my question. I've had other injuries that made CRPS spread, but every time I've been able to start treatment in those areas have went into remission. Okay. I still have flare-ups in those areas, but it's not nearly as bad as my left hip leg. The only thing that helps my left hip or leg is my DRG. When that's not working, I'm bedridden. When it is working, I can live a pretty normal life. Nice. I still have to walk with a crutch and I still have precautions, but I'm always in pain. But with the DRG implant, it's manageable. Is my hip leg so much worse because it was not treated for years? Is that way I can recover, quote unquote, from CRPS in other areas of my body, but my left hip leg is not improving anymore? Oh man, you've been through a lot, Julie. You're like the Terminator here with all this reconstruction and everything. You're pretty strong, pretty strong. Everyone asking questions in this and watching this video is by virtue of the fact that, we're dealing with one of the most painful things anyone could experience. Um, but, it's complex, as to why you can recover in other areas, but not in the left leg. What's interesting is, as I work with clients and patients, when I start to calm the nervous system, or when I give them the tools to do it and they do it themselves, when their nervous system sort of calms down, what I often see is if it has spread, because of, remember, the brain's map being smudged, if it has spread, what usually happens is it spreads or it retracts or it reverse spreads, despreads maybe, back to the original site. Okay. Like it comes down, like let's say it started in the left hand and it has spread to the right hand and both feet. What I usually see is feet get better, right hand gets better, and then left hand is the last remaining piece of the puzzle. So, you know, I wouldn't, I would say that there's more that needs to be explored as to what might be the quote unquote underlying factor that is leading to this pain in the hip. Obviously, you've had extensive surgery, extensive break-ins, but what else could be going on? I mean, this was back in, 2013, so we're 11 years out. What else goes on in life when when we're having more flares in the left hip? Or when you notice more flares in the other parts of your body that seem to flare from time to time, what kind of theme can you find outside of activity that is happening? I have clients that get more pain around the holidays, and that's not because they're, exercising more or anything like that. That might be because they're eating more poorly or because their in-laws are in town. Okay. And I say that and you might laugh at that. But that's stressful, and that can ramp up our nervous system. So we have to examine, how can we relate to our in-laws in a different way and manage our stress differently. So yeah, a lot to unpack there, but I would say I would look for that pattern, write down when we're having these flares, what is going on emotionally that is making this flare happen. And sometimes just noticing that, believe it or not, can reduce the flare because it reduces the fear that there's something wrong with our hip or our thigh. Okay. You're not a hip, Julie. You are a whole and complete and complex human being. And so we have to look at the complexities of being a human being to find the answer for why this area isn't recovering or reaching a remission. Okay. Okay. Let's see. Hi, Chase. Thank you so much for all you do to try and help us and educate us as CRPS patients. Well, thanks, Becca. I appreciate that. I have cauda syndrome, which triggered full body CRPS after injuring my back, and I suffered right foot drop. Thankfully, I did many years of PT, worked very hard to relearn how to walk. I went from a wheelchair to a walker and then to a cane and AFO, which I've had for years. Thankfully, I was able to greatly improve the weakness in my right foot and lower extremity, and now I can walk unaided, for which I am so incredibly grateful for. Wow. Wow, Becca. First of all, bravo before I go to the rest of the question, but wow, super impressed by that. Um, okay. So, what else do we have here? I understand that you've discussed spreading in your other Q&As, but in 2020, I had a very minor surgery on my right foot and was not at all scared about it. And yet to actually receive the CRPS diagnosis, despite having full body and internal organ involvement at the time. Nor was I going through anything particularly stressful, difficult emotionally. Despite living with severe chronic pain and a variety of other chronic health conditions, I do believe the power in positive thinking, etc. After I had the outpatient surgery, which was to remove a cyst on my right ankle, I soon developed four large cystic lesions and went through to the bone, spread throughout my foot. I also developed cellulitis, then osteomyelitis, and was told I very well may have to have my foot amputated. The wound healing was very, very slow and went from wound care to the hospital twice a week for 6 months, in addition to my own care at home. At the time, no one understood why or how this was happening to me, as I'm not diabetic, but I later learned that it was due to my immune system being affected by CRPS. Thankfully, I narrowly avoided losing my right foot, but I would appreciate your input as to why something like this could have happened. I did already have full body CRPS, so I'm not suggesting this was spread to the right foot, but I really appreciate your input, not only in my particular situation, but in also how CRPS affects the immune system in general. Whether a person has full body CRPS or only in one limb, what are your thoughts? So Becca, I would need some more information on you just in general, maybe one-on-one to really like fully answer this and understand everything underlying in your medical history, because it sounds like there's a lot more going on than just CRPS. But what I would say is, again, when we're stuck in fight or flight mode, the immune system isn't going to work that well. When we're in fight or flight, it's the same system that we use to run away from a lion. Okay. Our body redirects blood flow to where it's important, which is our extremities, because we have to use our muscles to run away or fight the lion. That's why with CRPS, we get, certain color changes in our limbs or swelling and things like that because of that redistribution. Our body also puts us into, as Sandy mentioned in question number two, fight or flight breathing, that actually not heavy, but fast breathing, those quick inhales and exhales, that chronic stressed out feeling. So yeah, of course, if our immune system is stuck in hyperdrive mode or fight or flight mode, then our immune system isn't going to do that well. But that's not necessarily due to CRPS. That's due to being stuck in fight or flight. Okay. CRPS is not, again, it's not a venom that's taking over the body. It is a nervous system that is hyperactive. Okay. So yeah, that would be my take. The reason why CRPS might show effects on the immune system is because of that hyperactive nervous system. But Becca, I'd like to talk to you more if you feel like it, and you can reach out to me on my website there for further consult if you're open to it or if you're looking for more help. Okay. Um, is that it? Oh, okay. So I think yeah, I've gotten to the last question there. Let me take a pause here and I'm going to pop over to Facebook and just make sure I haven't missed any questions. And then I'll also pop over to the self-guided program to make sure I haven't missed any questions that are popping up there. So I'll be right back. All right, I'm back. I found a few more here. Okay, so let's see. I found a few from my Facebook and a few from another Facebook group that I'll answer, or one from another Facebook group. So, Wade, or actually, this is Karen. Not sure if it's too late to ask this question, but if this is still up, I want to give it a shot. This is Karen on my husband's Facebook. I broke my ankle 18 months ago and was diagnosed with CRPS by a former orthopedic doctor. I am open, mobile with good and bad days, but thank God my balance is back and I am walking. Awesome. The swelling is mostly gone. It's just on and off, pain and stiffness at this point. My question is why sometimes when I sit down and rest, my ankle up after being on it, after sitting for several minutes, when I get up to take a step, I have a shot of pain and will have to stand there and massage my ankle to get it going again. This does not happen every time I sit down, just sometimes if I'm up and moving it, once it gets going, it's okay. It's just sometimes after I rest it, this happens. Just wondering if this is common. Yeah, Karen, this is something that is common. If you're for anyone, who had any type of injury, not just CRPS, okay? If you're going and you're resting after walking and then suddenly you're elevating the ankle, and then you go and quickly remove the elevation and step down onto it, you're going from a position where blood has started to flowing backwards, and you've moved it off and you've dropped it down, and then you started to step on it. It's kind of like you're shocking the system and not not giving it a chance to like wake up. So if you want to avoid this and having to massage to get it going, as you say, why don't you what you do instead is after you take the foot off the table or wherever you're elevating it, do some ankle pumps like this, pump the ankles up. Okay, so it look like this. Okay, do it pumping the ankles. Can you see that? Like that. About 10 to 15 times. Get the blood flowing, get the muscles contracting, and then stand up and go to take a step and see how that helps. I wouldn't fixate on it too much. It's not something that sounds super bad or scary to me in any way. It's just a sensation that you're having while you're retraining the system. But you're on the right track. I mean, your balance is back, you're walking, swelling's gone, you're just having on and off pain. This is the process by which we retrain the nervous system and get out of pain. So continue forward, Karen. I'm proud of you. You're doing good. Okay. Pat. Actually, I'll get to Pat's next. Rachel, is CRPS quote unquote curable? Do those in remission have an occasional flares? If yes, what are some typical triggers for flares? So, me personally, I don't approach CRPS as something that needs a like a cure. Okay. I don't align CRPS with, a disease like cancer. I think that that is fear inducing. I think that is scary. And so what I see CRPS as is something that needs the nervous system needs retraining. Okay, the nervous system needs comfort and care and a gradual approach to activity again. Okay, so in that sense, not only do I think it's possible to recover from CRPS, but so do most of the scientific community. If you go to, I'll try to find the link here, but I'm pretty sure it's the National Institute of Health in the UK. They say that 85% of people will fully recover from CRPS. And go on to live normal lives within the first 2 years. Okay. And even in the worst statistics that you can find, I think 10 years ago, they were saying that only 30% of people get better. But the fact that people get better says that CRPS is quote unquote curable. Okay. And I see it all the time. I have articles on Google about my patients. I have testimony on YouTube and on my Facebook group about people getting better. So yes, in that sense, CRPS is quote unquote curable. But I don't really call it like a cure because I don't see it as like a disease in the traditional sense. I see it as a hyperactive nervous system. And the reason I use recovery instead of remission is because it's not something that is lying dormant. The reason that we would get a secondary flare or a recurrence of CRPS is again the nervous system becoming more hyperactive. So one of my clients that I'm working with now, I'm working with them for the first time, but this is their second bout of CRPS. And the reason, what seems to be that they were extremely stressed out at college. They were focusing almost entirely on their studies, having no social life whatsoever. And then all of a sudden they had this breaking point where their nervous system just said, nope, you know what, I'm done. And boom, here was this flare. So the triggers for flares, like in a recurrence of CRPS, are going to be overloaded nervous systems due to stress, due to the death of a family member, due to an estranged sister not talking to you, due to marital issues, due to financial issues, etc. And those reasons for triggers are often the very reasons that people end up with CRPS around an injury or without any injury at all, because the nervous system is ramping up. I myself developed CRPS after I had two back surgeries. The first back surgery was 6 months after my mother died. The second back surgery was 6 months after my brother died. And then I developed CRPS. I don't think that's coincidence. I think that my nervous system was through the roof and I couldn't calm it down. And eventually that pain developed. My alarm system was freaking out. To answer your questions, is CRPS curable? Yes, I say yes. Do those in remission have occasional flares? They could, but because their nervous system is getting hyperactive. And then, if yes, what are the triggers? Exactly what I just mentioned: stress, emotion, overwhelm, physically and mentally. I myself have not had pain for 7.5 years, and I say with confidence, I do not fear it coming back. And because I know that it would upset some of you potentially, I'm not going to do this, but I could take right now and hit my foot as hard as I want, and it would be fine. Okay. And so if some of you want to see that privately or something, let me know. I'll send you a video if that what you want. But I'm keeping the sock on. Okay, I'm just joking. But yeah, so there's a lot of fear and anxiety around CRPS, but I encourage you to look for the success stories. They're on Google. This one here, they're around. They're within the groups. If you look, people are saying how they got better, and it's generally the same stuff I'm saying, and they're not even people that worked with me. Okay, it's gradual exposure, gradual retraining of the nervous system, mind body work, meditation, relaxation, and setting boundaries in their life. And the pain comes down and they move on. Okay. Okay. Now, Pat, the doctors where I live know little about CRPS. How can I educate them on what it is? Is there a way to give a presentation to a group of doctors using your video? Do you know where I would start with being able to do this? I would love to educate doctors in my area. Pat, what I'd like to do, you work with me, so I can get your address. I'd like to send you a bunch of my brochures, and you can get them those brochures in their hands, and they'll be able to watch my videos. Eventually, what I'm going to do is I'm going to offer CEUs, continuing education, for doctors to take my course and learn the ins and out of CRPS that I've learned along the way. So that's in the works, and if you want to help, I'd love to send you some brochures. Okay. And if anybody else wants some for their doctors, let me know. Maybe eventually I'll be able to do like an ordering system where I can send them to you for free and you can get them handed out. Okay. And then Christy, last one. I'm curious about your face and ear heating up. Mine has been doing this a lot. I feel the flush starting and then one side of my face and ear will turn bright red and burning hot. Is this normal for a lot of you? I've been keeping track of it and usually does slightly flare up of pain. So for Christy, I would recommend when you keep track of it, write down what emotions you might be feeling during that time. When we get angry, our faces turn red. When we get embarrassed, our faces turn red. When we have a nervousness about the future, we get a gut feeling. When someone breaks our heart, we feel a heartache or a heartbreak, and it hurts in our chest. Okay, so I would actually consider what is going on in life when that sensation is happening. And then I would also consider that, keeping track of this stuff might actually not be helpful. The alarm system, as I've mentioned through this whole video, is freaking out. And that's just the nature of the condition. Calming the alarm is the answer. We keep it simple. Find things to bring us calm, find ways to move back to activities we love and enjoy. And that is the process by which we calm the pain of CRPS. Okay, so that is Q&A number 4. The next one is going to be out. I'm going to give myself some grace. So 2 weeks from today, so February 15th, no, no, February 22nd, 2024. So keep an eye out for that. And if you want to ask questions, post them down below in YouTube, down below in the comments on our 8-week self-guided program, or on my weekly Facebook post in the Facebook group, The Window Pane. Thank you guys so much for watching. Again, sorry for the delay. This one took 3 takes because of the little breaks we had, but I hope it was helpful. And if you have any questions, of course, ask away or reach out to me on Facebook. I welcome it. Thanks again, guys, and I will see you in the next one. Take care.